Mark Kukovich, Division Chief, Sioux Falls Fire Rescue. We wanted to bring you all in to talk to you about kind of what's going on as far as EMS response within the city of Sioux Falls in relation to changes and alterations we're making in regards to COVID-19. We wanted to bring in all of our response partners. So we got myself from Sioux Falls Fire Rescue. We also have Mike Hero from Patient Care Logistics Solutions. We also have Scott McMahon, Director of Metro Communications, which is our 911 center. And we also have Lieutenant Toom from Sioux Falls Police Department. So we're going to kind of go in order here. I'm going to turn it over to Scott McMahon from 911 Metro Dispatch. He can kind of give you an update on some of the changes that they've made on the call taking process for responder notification and the upgrades that we've made there in order to gather better information.
Good afternoon, Scott McMahon, Director of Metro Communications. Metro Communications is a 911 public safety answering point for law enforcement, fire, emergency medical services, and emergency management in Minnehaha County. Our team of 911 operators are often the first contact during an emergency event. Our mission is to provide community service, quality service, maintain professional standards while enhancing the life and safety of our community by serving as the lifeline between the public and the first responders. Our team has received special instructions pertaining to information gathering related to the COVID-19. We have initiated a screening tool to assist us in information gathering for all non-trauma events. Here are the changes that we've recently implemented. Our team will ask callers if the patient has experienced new or different shortness of breath with a fever or persistent cough. In addition, our team will also ask the patient if they've had contact with someone with flu-like symptoms recently. Last, our team will also screen the patient for recent travel history. The information that Metro Communications gathers is critical to the prevention of protecting emergency responders from COVID-19 so that our team can remain healthy and ready to respond to the public. 911 should always be contacted for emergencies and public safety needs. For information specific to COVID-19, please contact covid.sd.gov or 1-800-997-2880 for the South Dakota COVID-19 information line. As always, if you feel like you have a non-emergent symptom, please call your healthcare provider for guidance. Thank you.
Hi, good afternoon. Lieutenant John Toom with the Sioux Falls Police Department. And our department has looked for ways to change how we handle some calls. The objective is to limit the amount of person-to-person contact we're having, to help slow the transmission of any diseases and also protect our first responders. It's something that we all collectively have to get behind if we're gonna have good results. One of the ways we're working to some changes, since 2012 we've offered online reporting, and now with a press release this morning our chief has put out, we're going to now mandate certain calls be given that online reporting option, and those are listed. 6 different report type calls we have are harassing phone calls, lost property, theft, vandalism, vehicle vandalism, and thefts from vehicles. So that now will be offered as an online reporting option. If it isn't possible for that person to make an online report, they will be added to a phone report section, and then officers will get with them as time allows to make that phone report. This just minimizes our person-to-person contact we have on a daily basis and helps protect our first responders. Like many departments across the country, we're taking steps to limit the spread of COVID-19, and by making a few changes locally, we hope to impact that, keep the public safe, our officers safe, and still provide a high level of service. First responders are a finite resource, and we need to do everything we can to protect those responders, but we also need to perform our function to the community. And the community can help in many ways by just notifying us of any issues that you have up front and understand the constraints on our time and what we need to do to keep a safe distance. Services may not be like what you're used to seeing, but they will still be the same quality and will still serve the residents of Sioux Falls on a day-to-day basis.
The emergency medical system as a whole continues to stay committed to providing high-level EMS care to the community. In order to do that, that takes our human resources make that happen. So in order to do that, we got to continue to protect our human resources. So we've implemented a couple things. Number one, the call taking process through Metro Communications, gathering that information from the caller on if there's any suspected flu-like symptoms, any suspected positive testing or known positive tests, or any other information that's relevant to the call as far as that could transmit to a responder. That way we can also utilize personal protective equipment. So when you see our personnel on calls where we have patients that with flu-like symptoms or suspected symptoms, you're going to see our people in full PPE. They're going to have safety glasses, they're going to have N95 masks on, and they're obviously going to have gloves on like they do on every other call that they go on. That's the way that we can help protect our responders, but that starts with the information gathered from 911. And then beyond that, we are going to probably ask the patient to put on a mask. We'll provide a mask, a surgical mask for the patient to put it on, and that's one of the things that we can do to help control the expiration of the patient, to keep it from getting close to the responders, and then we'll also protect ourselves as well. So those are a couple of things that we're putting in place for our personnel to help keep them safe, along with all the other CDC recommendations, social distancing, and all the other recommendations that they've provided, and they continue to provide and send out updates daily that we brief at in the afternoon among all the partners in this room to make sure we're making the best decisions and putting forth the best system that we can. I do want to bring up Mike Bureau from Patient Care Logistics Solutions to have him talk a little bit about the transport side of things.
Certainly. Good afternoon, everyone. So to begin, in addition to our normal ambulance accredited cleaning processes that we normally use, we are also adhering to the CDC recommendations that were released approximately 2 weeks ago. On top of that, we continue to adjust and monitor our PPE stock and our stocking processes to ensure that we have the appropriate CDC recommended equipment available to protect our patients, our employees, and our community partners as we move forward. In addition to those messages were provided by my community partners, we'd also like to strongly urge the public to notify responders upon their time of arrival or upon placing a call to 911. If someone you live with has been identified with COVID-19 as a positive identification, or if you've had recent contact with somebody who has been positively identified with COVID-19. We'd also like to reiterate that as a team, we are all working together to follow and adhere to the CDC best practices as they have been given out here in this fluid situation.
At this point in time, we'd like to entertain any questions that you might have related to this.
Well, say someone's calling in a heart attack, I think the last thing they want to do is go over a bunch of questions about whether you've been traveling or where you've been and who you have contact. I think they want to know that someone's being sent. Is that the case?
Correct. You want to take that, Scott?
Yes, in a trauma event, we will not ask the additional screening questions that we're asking for non-trauma events. So the additional screening is for non-trauma events only. A non-trauma event might be like a lift assist, or it might be from a fire site, it might be a smoke alarm or carbon monoxide detector, those types of things that are fire related. Police related, it could be all kinds of events such as maybe an event in somebody's household that is non-violent and non-urgent.
Have you responded to any calls so far with this new process?
Yes, as a matter of fact, since we've implemented the screening tool, we have had a number of what we have identified as positive to the questions pertaining to screening for COVID-19. Now, that doesn't necessarily mean that this person has COVID-19, but it's a screening tool to let our first responders know that they should take extra precautions to be safe. We implemented the screening tool just this afternoon. However, prior to that, we had a limited version of the screening tool that was in place. But this afternoon, we did implement an additional question.
I couldn't hear the question.
How many times have you put on additional PPE based on the screening?
So we always carry the PPE with us. As far as additional PPE wearing, we'd have to dig into the actual report and PCRs on that in order to get the actual numbers, but it has been more than what we do it on a daily basis. Don, going back to your question a little bit, so if somebody were to call in on chest pain with a chest pain complaint, the additional questions would be asked, but at that same time, Metro is dispatching the fire department and the ambulance and police department to respond to the incident, and we are responding as normal. It's just we're going to take better precautions if one of the screening questions or multiple screening questions are answered as a positive. So the response is still the same as it always has been.
And a question that comes from reporting crime, I mean, people get so used to calling 911, say, hey, there's a burglar outside my house right now, he's trying to break in. If you're going online to do that,
Oh, sure. No, a burglary would not be an online reporting call, right? Emergent calls or calls that are in progress are still the same calls we're responding to. But the reality is a lot of the calls we get can wait, and we're looking at those calls that can wait, that are not emergent, to just handle them a different way, because that's something we can control. We can't control if someone's breaking into your house, and we'll respond like we always have with the same measures. But the ones we can control, we just want to have a little better take on, because our reality is we have to respond no matter what. So.
And the public can be assured that there's going to be somebody monitoring those online requests
Yes.
constantly.
In fact, we've already had this system in place for either phone reporting, for online reports, and it really has worked really well. We just haven't really, I won't say forced, but strongly encouraged that they use that, because for many people, having an officer come to their door is how they want to report that crime. That's what they're used to, and we fully support that, which is why we do that. So for us to come and take this step right now and say, hey, we really want you to use this tool, or we really want you to use phone reporting, just kind of stresses to you how seriously we're trying to limit our interactions and keep both the residents safe and our first responders safe. And this is one thing we can control, and we have to just make our best step to do that.
Are there a couple of cases that you would prefer people do an online, like if there was a weapons violation or something?
So a weapons violation, I would expect them to call 911, right? And I would expect them to still use that same procedure. And the same call-in procedure, as far as if I dial 367-7000 for something I feel that's not an emergency, you know, that will still maybe push them towards the online reporting or the phone reporting if they don't know, right? But the stuff that's non-emergent, like a fraud, for example, or something that happened several days ago, they just discovered, that's where the online reporting tool is really helpful. Or when prompted by a dispatcher to explore that online reporting tool, we really want them to strongly consider that option.
Any other questions? In closing, we'd just like to remind the community to help us out. And the biggest way you can help us out is provide the information to Metro 911 dispatch when you call 911 as far as the questions that they ask, so they can give us proper information to protect ourselves as well as protect the patient. And then we also ask them to follow CDC guidelines that are being put out daily as far as updates on how they can keep themselves safe and stop the transmission of the disease, whether it's in their home or in their business. And we just ask that everybody kind of follow the CDC guidelines and stay up to date on them as they come out.